Greetings, my name is Jamie Stagg. I am a pharmacist and quality improvement advisor with Quality Health Associates of North Dakota and the Great Plains Quality Innovation Network. I'm fortunate to have had the opportunity to collaborate with the OneRx team from North Dakota State University, and I'm proud to present our work entitled OneRx, Community Pharmacy-Based Screening and Interventions for Opioid Misuse and Accidental Overdose. The poster objectives are to describe the OneRx program, its training, tools, and processes utilizing pharmacists to screen, evaluate, and provide appropriate interventions to patients receiving opioid prescriptions. Community pharmacists have the opportunity to play an essential role in the opioid crisis by providing upstream interventions. This has been challenging, however, with pharmacists citing barriers such as lack of competence and limited training and time. In response to these barriers, a team of faculty at North Dakota State University developed the OneRx program. OneRx stands for Opioid and Naloxone Education. It is a patient-focused intervention promoting safe opioid use. An initial pilot in 2017 was expanded statewide in 2018 through a grant from the North Dakota Department of Human Services. The first principle of OneRx is training and education. A 3-hour continuing education program developed both in person and online includes topics such as opioid risks and benefits, naloxone, communicating with patients about opioids, and training on the OneRx screening process. Pharmacists completing the training can then opt their pharmacies into the OneRx program, where they're provided with program materials and resources which they can incorporate into their existing workflows. The patient care process begins when a patient comes to the pharmacy to receive an opioid prescription. They are asked to complete an intake screening form that screens for both risk of opioid misuse and risk of accidental overdose. The pharmacist determines which of the key interventions are needed using a triage tool. The patient questionnaire includes the opioid risk tool, or ORT, which is a validated tool used in multiple settings to determine risk of opioid misuse. Screening for risk of overdose is slightly more subjective and includes a review of the prescription drug monitoring program, patient comorbidities, and concomitant medications. A triage tool provides pharmacists a visual flow diagram to identify the appropriate intervention based on screening results. The recommended interventions include universal interventions, along with those that are based on risk stratification. Interventions include a partial fill of the opioid prescription, education on safe medication disposal, naloxone education and dispensing, discussion of available community support services, contacting the prescriber with recommendations, and education on opioid misuse and overdose. The OneRx program provides resources to support the indicated interventions, such as connections with local public health units, enrollment in the North Dakota Board of Pharmacy's medication disposal program, and distribution of educational materials from national and state agencies. The results of the programming have been encouraging. 240 pharmacists out of about 1,000 active pharmacists in the state completed the OneRx training. 75 community pharmacies, or about half of those in the state, have enrolled in the OneRx program. Looking at screening results from the reporting period of October 2018 to June 2020, over 6,000 screenings have occurred. Characteristics of note in those screened include an ORT score indicating high risk of opioid misuse occurring in 4% of screenings, and risk factors for accidental overdose being identified in almost 20% of screenings. Also, chronic opioid use is common, with about 35% of those screened receiving another opioid in the past 60 days. The intervention results have been very positive, with pharmacists taking appropriate action based on individual patient needs. Discussion on medication disposal occurs almost 90% of the time. A key highlight is the naloxone dispensing rate of 9.5% for patients identified at risk for overdose. This rate is 6 times higher than the 2018 national average of 1.5%, as identified in Morbidity and Mortality Weekly. In addition, pharmacists have provided anecdotal reports on how the program helps them have a level field and how it makes more difficult conversations more approachable by being able to tell all patients receiving opioids that they are asked to complete this screening. It helps the patient avoid the feeling of stigma and being profiled. In conclusion, OneRx is an effective program demonstrating the impact community pharmacists can have in the opioid crisis. The program has demonstrated effective and efficient screening for opioid misuse and overdose risk, appropriate actions taken by pharmacists using validated tools, and an increase in the dispensing of naloxone to at-risk individuals. We look forward to continuing this program and expanding it into other areas. Thank you for viewing our poster presentation. Feel free to contact us with any questions and feedback.